First at 11, the latest on the coronavirus here in Ohio. Health officials now confirming 19,335 cases in the state with 1,021 deaths and roughly 3,700 people in the hospital with COVID-19. Thanks for joining us for NBC4 at 11. I'm Mark Taylor. COVID-19 antibody testing is now available in Central Ohio. This after several other states have already begun. But not just anyone can get tested at OhioHealth. NBC4's Eric HALPERIN is live in Columbus tonight with how the hospital system can test hundreds of patients a day here. Eric?
Mark, OhioHealth just started antibody testing Friday and can test about 500 to 600 patients a day. But it is important to know you need a healthcare provider's order before being tested. This is a bit different than a couple of other states that are doing more widespread antibody testing for studies. Ohio is not doing that right now. Antibodies are what the body produces to respond to an infection. OhioHealth's medical director of infectious diseases says the test can show if the patient has developed an immune response to COVID-19, being an indicator of if someone has had it or not. Dr. Joseph GASTALDO calls it another tool to assess someone for COVID-19, but stresses it cannot be the only one. He says people have to be very careful with what they do with the test results because there is still so much unknown about COVID-19. For example, how antibodies affect the common cold or chickenpox has been widely studied, but COVID-19 is still new.
So we have to be very, very careful when we talk about COVID-19 antibody tests. We don't know with certainty what it means as far as immunity goes. It's not meant for me to tell you, hey, you have had COVID-19, you can't get it again. These tests are not meant to say that.
And Dr. GASTALDO wants to make it very clear. He says just because someone has a positive antibody test does not mean they can stop social distancing. He also says he expects other hospitals to start antibody testing soon as well. Live and local for you in Columbus, I'm Eric HALPERIN, NBC4.
All right, Eric, thank you.